to the World Health Organization, also approved and recognized, and greater than 160 countries were practicing acupuncture globally, right? So now let me start the step by step. What the concept today is the Qi, and then is the Taoism techniques which we highlighted in the group. Of course, before going into the Taoism techniques, step by step we will see that in the preliminary level about the Oxford Dictionary, what it says for the acupunctura. Acupunctura is the Latin word in generally the system of the complementary medicine, which fine needles are inserted in the skin at the specific areas or the junctions or the points along what are considered to be the lines of the energy or the meridians or the channels or the pathway or the connectivity used in the treatment of the various physical and mental conditions. Of course, is the physical conditions we all know, so related to the numerous diseases, but however it is the CAM. Eastern medicines are different from the Western medicines, right? Western medicines are known as a modern medicines. Eastern medicines are known as a related to the traditional medicines. We look into the traditional Chinese medicine, normally called as a complementary medicine, which comes the naturopathy, yoga, various traditional medicines. Like you look at about any country, which previously I told about the Indian traditional medicine, Indian traditional Chinese medicine, traditional Mongolian medicine, traditional Vietnamese medicine, traditional African medicine, traditional Mexico medicine, traditional Mongolian medicine, right? Traditional Eastern medicine, so on. So many tribal medicines are existing. If you look at about the National Commission for Indian System of Medicine, which having the Naturopathy, Yoga, Siddha, Ayurveda, Unani, Homeopathy, tribal medicine called as a Sova Rigpa has been integrated. Now medicines are called as a alternative, complementary and traditional medicines, right? So this is in fact is the complementary medicine in which the fine stainless steels needles are inserting. Needles are numerous different qualities and different sizes and different gauges, right? Different lengths and different colors and different kinds of the copper, silver, metal, gold, right? So many different modalities are there. In that the silver needle also is existing for the sedation, and then the gold needles are existing for the tonification. In fact, we do have one needle I kept in our center related to the gold needle. Nearly Indian rupees is 2,900 rupees is the per single needle. For the tonification they generally use in China, but of course that also rarely people use it. But however for the sedation they use the normal stainless steel or the silver needle, also recommended. So in this way there is the inserting in the skin at the specific point. The specific point is the very imperative here. So normally there are the two types of the acupuncture in generally. One is the acupuncture has been derived, and then there is the specific bundle of the fibers or the specific nodules called as a fibrocystic, specifically that particular area where having the low electrical conductivity. So that particular place there is the junction is there. How there is the one from the Jammu Kashmir to the Kanyakumari, there is a train. In the train there is the pathway. In between there are the numerous junctions, right? The junctions are different from the stations. The stations we will get 1000 stations, for example. Now the junctions are nearly 100 junctions. But like that, so there are the certain, the entire pathway of the meridian or the channels is, there is the each and every specific region there are the acupuncture point, but all the acupuncture points are not the junctions. Not all the junctions are acupuncture points. Of course sometimes we can consider the junctions are acupuncture points as well, but the entire pathway we can consider that that particular region, there are the specific junctions or nothing but is the acupuncture. Ruling points are existing, commanding points are existing, and then there is the numerous energy on that particular region, abundant chi which is accumulated on that specific point. Normally we recommend to do some kind of the pressure point to activate some of the conditions. For example, eye strain, you just activate some of the point which we call as a Tai Yang. Tai Yang is the one specific area. We just activate this particular region where the temporal region, the greater yang is existing on that particular region. The maximum yang, Tai Yang, is the greater yang which is existing on the region of the temple. That name itself has been kept as a Tai Yang, is the extraordinary acupuncture point which is located on the temple region. So we just activate this. And certainly there is a great impact to regulate the optic nerve, regulate the ophthalmic nerve, regulate the tympanic nerve which is communicating to the ear, and also regulating to the temporal artery and then temporal nerve. So similar way there are the specific regions, but however I can say each and every part of the body, according to the Ayurveda, it says 72,000 nadis are existing, but 72,000 nadis is nothing but is the 72,000 holes or the channels or the meridians or the passage or the specific areas or the junctions are existing in our body system. So each and every part of that, at the same time, if we understand about the cosmic level, then we do get the sweating perspiration. That perspiration, you cannot see one specific part is coming, the other part is not coming. If I got the sweat on the glabella region, but I can see the entire glabella got this sweat. So indicating that there are the micro level holes are existing, that holes also which is communicating to the heaven, which is communicating to the cosmic energy. That energy of course is associated to the body system, that is reflecting each and every hole to be known as is the acupuncture foci. Foci is nothing but is the location, right? So therefore there are the micro levels. Now as I told you, Jammu to Kashmir, there are the trains and 1000 stations are coming, but perhaps it is thousands of villages and towns or the houses are coming on the pathway, isn't it? So in the similar way, this also is the micro holes to be considered as the cosmic energy holes. So because when we understand that chi is nothing but existing anywhere in the universe and omnipresent of the chi, and that chi is promoting and then entering through these holes as well to the nourishing to our body system. But however, acupuncture is specific junctions, so that junctions we are activating to the nerve fibers of the body. The nerve stimulator or the nerve fibers we are activating, stimulating to the specific areas of the body to regulate the chi and then flow of the energy. So that's what according to the Oxford Dictionary, and as per the WHO says, acupuncture is the Latin word, so is the acus. Acus means is the needle, and then punctura means is the piercing, right? Is an ancient and traditional system of medicine for the treatment of the medical problems. For the treatment of the medical problems, here consider as a treatment of the various physical problems. Physical problems and then medical problems more or less is the same. The treatment of the, which means puncturing the standard needles, acupuncture needles at appropriate sites of the body called as the acupuncture points or the acupoints or the AC point. Now here what we need to understand about the medical problems related to the bacterial, virus, protozoous, fungal infection, so on. Apart from that, anything connected to the any diseases like a hypothyroid, hyperthyroid, right, blood pressure and cardiac problems, other so on. So many medical hundreds or thousands of diseases are existing. Those diseases also can be recommended to treat by using the acupuncture modality of the treatment. And also here it says is the mental conditions as well according to the Eastern medicine, because we understand today the people are suffering numerous day to day. We do have the panic conditions where the schizophrenia or the hysteria or the mania or the anxiety or depression or dilemma or the people are very confusion mind today, to the could not able to take the right decision on the right time. All are connected to the mind related disorders. So therefore once we activate some of the points on the body system, that having the great tranquilizing effect, that great hypnotic and sedative effects, at the same time it is the tonification effect to the body system. So once I will see there is a specific point, normally my beautiful point, normally I activate myself sometime. So whenever I see lot of patients on that particular time, because we do have one problem, you understand, taking ourselves is our problem is great problem to us, and taking all those problems on my head and then treating to the number of the patient till 11 o'clock, and then that also it gets some kind of the stress. But however I don't take it by the way stress, but when I feel slightly warmness in the central nervous system, that particular time normally I just activate one particular point, that point to be activated or the sedated, to be tonified or the sedated. You can look into that, and specifically one point as I told you. So this is in fact is the one great point where exactly I relax myself to once I sedate this specific point. Just I applied the sedated the DU20 point, right? You can see this is the DU20. Wherever your hand goes, and take the needle and then insert on the vertex of the head. Whenever you feel stress, whenever you feel hypertension or something connected to the insomnia or the warmness in your head region, that particular time I just inserted the needle to calm down, because that particular point is located on the central part of the cerebral cortex of the brain. So that particular region once you activate or sedate, so activation when the person is not too active, that time you just tonify towards the Dhumai meridian, where the meridian from here ends on the frenulum of the mouth. So if you apply this direction, that to be tonification, the person will be more active. When the person is stress is there, that particular time we wanted to sedate that stress, that particular time we just apply in the opposite direction. However, when you are in confusion whether stress is there or not there, you just apply perpendicular, that also works wonders. Right? So in this way the mental problems, once we activate one specific point, remember this is the key. So all the head related problem for the day to day is not the disease. Disease is entirely different from the, because the disease categories also can be divided into two. So one disease to be called as is the exogenous diseases. Exo means external, right? Extrinsic factors which is causing the problem through the external environment, causing the kind of the viral infections or the bacterial or the protozoal or amoebiasis, so on. This is one thing. Of course, for that is acupuncture works, and then sometimes we need to take some kind of the support of the Western medicine or the Ayurveda or the Indian system of medicine, as a herbal medicine also can be taken. But when we wanted to take the treatment related to the endogenous disorders, or the endogenous is nothing but is the emotional impact is getting the problem, which is related to the mental related disorders, anxiety. Today the people are very, very miserable because of there is something somebody told, the husband told something to all of you, or here is the wife told something to them, and they take it to their mind. The whole day is very, susceptibility, very sensitive, and that particular time there is some kind of the heaviness, there is no mood is coming to work because my wife is told something, right? My wife always says good, okay, don't think about my wife, right? Then you ask separately to me, then I'll tell you what my wife said. Right? So in this way, however, by the way, she is good, right? So she have taken the class also for to all of you. Then you should respect, okay? You shouldn't disrespect. If I disrespect, no problem, but you people shouldn't disrespect her, okay? Right? So where I was? Emotional problems, right? So this emotions is getting impacted for the day to day. So that particular time you remember, you just activate yourself. Whenever you feel discomfort, and then you feel the people who are above 50 years, they do have hypertension, and that time you just apply the needle on the top of the head and then relax. You remember that when I just applied, this is my experience, just I applied at 12 o'clock, 1 o'clock in the noon, and then I just after coming to home, then I have done the cleaning and everything on my face and head and all. So that time I have seen something is is there. That time I took that micro needle. I just used, because 1 chun, half chun, it looks me that I just applied the needle. That time I just used the micro needle. Micro needle is a very small needle, tiny needle. I just inserted on that, so I cover with the hairs and it doesn't look outside. So my work is also going on pleasantly, at the same time treatment also going on. But I am really against sometimes when we are taking the treatment and providing the treatment to somebody else. I don't recommend. Right, that's not good. But however, this is not for the disease, this is to regulate my mind and then thought process, and to calm down my excessive energy. Right, when I am very, very active and my head is heavy, so normally monthly once, bi-monthly, or 3 months, 6 months once, I just apply this. This I am sharing you. Why? Because this topic also here is coming. Even you also can do this just as an insertion. That will calm down. This amazing. See, I just applied that. I feel some kind of this one particular point. Normally it releases the dopamine, serotonin, so which is required for a happy hormone, love hormone, right? So that regulates my body system to talk to you politely. So now we understand one particular point can be treatable number of the diseases, rather than putting the word any other related problem. Even any kind of the stress is there, that's not a disease, that is only the mental problem. Over the period of time, certainly you will get the impacted of the internal organs, causes the diseases, because your emotions got affected. So emotions are really good. When we wanted to get angry, and I think 2 days ago somebody asking me that, so doctor, nim kopane barodilva? And kanditak barutte sir, I said. So then I said, only a minute or two I get angry. A minute or 2 minutes I'll get angry. So after immediately I keep calm down. So that reaction and action, for that is required this kind of the anger, only for that particular moment, then will be calmed down. So again, keeping that same thing internally, that reflecting the internal organ, because when I take some of the specific classes related to the how emotions get impacted to the internal organ, that will be wonderful topic, so that we all, I myself and all the whole world, to be learn this art, how to regulate our emotions precisely, and then without taking to too much. Right. So in this way, the people who get, which is the mother for the emotion?
Heart.
Good. Which is the top emotion causing the problem? How many emotions are there? By the way, tell me.
Grief.
Very good. You have more grief, I think so, right? Tell me, come on.
Anger.
Oh, that's good. That's my favorite emotion. Okay.
Happiness.
Happiness. Wow. Good. See, good emotions. All emotions are really good. Crying, grief, sadness, worries, anxiety, thinking, no overthinking, or the frightening, frustration, rage, resentment, right? Delightful. All the emotions are really good. But which is the superior emotion to control all the emotions? Which is the mother for the diseases like that? So which emotion causing the more pathetic situation and miserable? That is anger, that reflecting on the eyes, right? Anger is the great emotion that today you can look at the people, you just do the ultra scan and the maximum people will get the fatty liver, reflecting through the liver. So liver is impacted by the anger, our emotion, right? Fatty liver is the common today because you understand most of the people having the no anger. That's the reason fatty liver or more anger causing the fatty liver. Yes, of course, I understand that also could be the reason because we do require one research on it. I think somebody do the PhD on the anger emotion, how the traditional Chinese medicine is giving the impact to causing the liver pathology. So once we do this analysis, hopefully this will be one task to the people who work for the public level, right? Good. So now we understand the Pai Hui Du20 point is the amazing and loving point. The name itself is the Pai. Pai means in Chinese is 100. Hui means is the connectivity. Where there is the connectivity to the heaven energy. The majorly what we need to understand, the human being we are, there is a connectivity to the human and then heaven. So that heaven connection through this channel where the antenna open to pour the energy to the body system. So therefore acupuncture according to the complementary medicine, Oxford Dictionary says it is the Eastern medicine, and also here we can consider physically, mentally, socially treatable by using the diagnostic methods and the therapeutic methods. That's called as a acupuncture. That's the reason it's not to be considered as only the therapy, but this to be considered as a system of medicine. Many countries having the licensed acupuncture licensing, that means is the we call as insurance facilities for acupuncture as well. The people who wanted to go and take the treatment, and the insurance will give the remuneration for that, right? Now we understand acupuncture is known in China, we call as a Chen Chiu, ZHENJIU. I think one video we uploaded in the YouTube channel. Please have a look what is the brief abbreviation about it. In Japan we call as a Shin Kyo. In Japan we call as a Shin Kyo. In India we call as a Bhedan Karma. For the acupuncture in India we call as a Bhedan Karma or the Marma Chikitsa, Soochi Chikitsa, Dagda Chikitsa. That's called as a Dagda Chikitsa is nothing but is the moxibustion, and extensive literatures on the Soochi Bedana Chikitsa are seen in the Indian traditional text. So I'll give you the task to all of you. Then remember is the Charaka Samhita. We all know that Sushruta Samhita is the father of the surgery, right? And Atharva Veda Samhita and Rig Veda Samhita and then Ayurvedic acupuncture. These are the books has been given the information related to the Veda Chikitsa, Dagda Chikitsa, Marma Chikitsa, Soochi Veda Chikitsa and Vedan Karma. So Soochi Chikitsa in Karnataka, in Kannada we called as a Soochi Chikitsa, right? Soochi Chikitsa to be recognized, that we have to bring that to the common people to understand what kind of the acupuncture is the Latin word, right? Latin word. The Chinese says is the Chen Chu. But what is in India? In the Indian Sanskrit name, we can bring that is the called as a Vedan Karma. Right, Soochi Chikitsa, but here is the Soochi Chikitsa in Karnataka as well. We can consider that. So that we will bring that awareness to the common people in order to get the more popularization. Now we understand, I think, who will going to take the task. Charaka Samhita, please bring the information where all this information has been given. But all of you, I recommend you, keep the textbook with the Charaka Samhita in your home, and then Sushruta Samhita and Atharva Veda Samhita and Rig Veda. These are the books of the ancient Vedic book system. So how the old books are there like that books. So those books also keep it with you for the evidence for tomorrow, and certainly where the acupuncture is not originated and then not, it started 50 years ago, but thousands of years ago, how the Vedas, Rig Veda, Sama Veda, Atharvana Veda was existing before. So through that resources it's coming. Even in the Quran, in the says, that is the we call as a prophetic medicine, we call as a Pachne Lagana. So Pachne Lagana in Urdu also we called as a, so we are piercing the needle inside the body system to regulate some kind of the flow. So these are the few evidences, but I do required for the next week. Today's no, which day today's 26th, right? 26th of March. Yeah. So we do have the class that particular time. All of you, please give me some inputs about the Charaka Samhita, where are you getting that information, and then Sushruta Samhita, where are you getting the information. You wanted to study something, you wanted to search something, you will get the novel things in that, right? Rig Veda also you just see, and then what are the various evidences which is existing. The originated acupuncture, that means Sushruta is telling, Charaka Samhita is telling, then the originated acupuncture from India, not from the China. So that evidences need to bring from your corner, so that keep it as a documentation and evidence for the world. We can show them how the Takshashila University is the first university in the world, started this acupuncture and acupressure, and then pressures activating. So that kind of the information also I recommend you take some of the novel information from the Takshashila, how the people from the different parts of the the various countries from the globe, and they studied there, and then they went to the other countries to practice. So this kind of the information certainly we do require that as a documentation. Now the evolution of the acupuncture needles. Now you can see acupuncture is the very ancient form of the healing, started from the old stone age around 10,000 years ago and beyond that. That's called as a Pian stone age. Pian is nothing but is the stone. Bian in Chinese is the stone. Much more before that there are the evidences, and the new stone age 10,000 to 4,000 years ago refined it into the fine needles for the healing process. The bone fragments and then bamboo sticks were also used. Later the evolution from the various metals, starting from the bronze, gold, silver, brass, copper, and ultimately iron, and now we are using on these stainless steel needles